Okay. So, hi, evening, friends. Evening, everybody, bache. Evening, everybody. So, let's start. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. And let us start today with our microbiology, the most important topics. Acha, before I even go further, I was getting few messages, personal DMs, as well as on Telegram, as well as WhatsApp with respect to pathology, which I will be giving you the new date for most important topics in pathology extremely soon. So evening Adya, evening Rosal, which evening everybody. So let us start. This will be a high yield session. I'll take care of the most frequently asked topics in microbiology in this. So starting with our first topic, keep on answering. At any point, if you think I'm going too fast, please do stop me then and there. So starting with the bacterial growth curve. Let's start with bacterial growth curve. You very well know it has a lag phase. Lag phase. It is the period between inoculation and beginning of multiplication. That is lag phase, followed by log phase. That is log phase. It is exponential increase in the number of bacteria. That is the log phase. Stationary phase, and then is the phase of decline. In the phase of decline, the viable cell count reduces. Evening as in evening batches. So this is the bacterial growth curve. Lag phase, log phase, stationary phase, and a phase of decline. So lag phase is the period between inoculation and beginning of multiplication. Log phase is exponential increase in bacteria. Now the point to be seen here is if log of viable cell count versus time is plotted in log phase, it is a straight line. It is a straight line. Then is the stationary phase in which the bacterial growth ceases. There is depletion of nutrients, there is accumulation of toxic products, in turn followed by a phase of decline where the viable cell population reduces. Agreed. So tell me these three answers. Tell me these three answers. Bacterial cell size is maximum at the end of lag phase, end of log phase, yes, stationary phase. Bacterial cell size. It is maximum at end of lag phase. At the end of lag phase, because that is when the bacteria is just ready to divide. It is maximum at the end of lag phase. Cells are smaller and stain uniformly in which phase of the cell cycle? These are the questions which will be asked from you guys, Viche. Bacterial growth curve is usually asked. Cells are smaller when they are rapidly dividing. That is in log phase. Whereas they are gram variable with irregular staining. There are differences in intracellular storage granules in stationary phase. So these were with respect to the bacterial growth curve, our first important topic. Evening Tanvi, evening Bache. So this was our first important topic. Those of you who have just joined and you have not missed out on anything, we've just started our session of the most important points in microbiology with our growth curve chart. Next, I'll be taking care of about 10 to 12 topics in this session. So the first main topic was growth curve. Next is the culture media. Next is culture media. The two named media. The first is the enriched media. Enriched media, along with basal media, it contains nutrients which can either be blood, serum, or egg. Blood agar. The whole classification of Streptococcus is on blood agar. We will be seeing Streptococci, blood agar, alpha hemolysis, beta, and gamma hemolysis. Chocolate agar is heated blood agar, which is used for answer, bache. We use chocolate agar for Neisseria and Haemophilus influenzae. Chocolate agar, that is heated blood agar. It has nothing to do with chocolates that we guys love. Versus LSS, Loeffler's serum slope. LSS, I want you to tell me this. I am sure you know this. LSS, Loeffler's serum slope is used for. I'm waiting for your answer. I know I'm going slightly faster and I'm not giving you much time to think, but that is the whole purpose of having the most high yield topics. That is, we cover more content in this session, which is Corynebacterium type 3A. Loeffler's serum slope, LSS, is for Corynebacterium type 3A. These are the enriched media. Versus enrichment media, extremely important, which are the liquid media. Enrichment are the liquid media which are useful for culture of feces. Why? In fecal matter, what happens is the non-pathogenic organisms usually overgrow pathogenic. Which is the most common fecal commensal? E. coli. E. coli overgrows salmonella. So to prevent that, we use enrichment media, that is tetrathionate broth. Which are the enrichment media? That is the tetrathionate broth which inhibits coliforms. selenite F broth, and alkaline peptone water, which is again used for Vibrio cholerae. Vibrio cholerae. So enrichment media are liquid media. Next is selective media. Selective media, they contain substances which inhibit all but a few bacteria. They are selective for the growth of few bacteria. So deoxycholate citrate agar, DCA, deoxycholate citrate agar, it is a selective media for enteric bacilli. Which ones? Salmonella and Shigella. DCA, deoxycholate citrate agar, Salmonella and Shigella. BSA, bile salt agar, which is for Vibrio cholerae, These are the selective media. They selectively pick up the organisms. And lastly are the differential media, which helps in differentiating between organisms. McConkey's agar. McConkey's agar differentiates between lactose fermenters versus the non-lactose fermenters. Lactose fermenters will be what in color? Sika, evening bache, evening everybody. So lactose fermenters will be pink colored versus non-lactose fermenters, which are colorless or pale colonies. So these were with respect to a second important topic, that is the culture media. Transport media, they are for extremely delicate organisms like gonococci or meningococci, which do not survive the time of transit, for which we use Stewart's transport media or buffered glycerol saline. First class. So these are the culture media. So this gets us to the next topic, that is various modalities, for which is the investigation of choice, or instead of investigation of choice, I should use the term that which are the various modalities for sterilization of these techniques, for sterilization of these things. Starting with clinical thermometer. We cannot use the same thermometer from patient to patient. We sterilize the clinical thermometer using alcohol, isopropyl alcohol. Paraffin, dusting powder, glassware. But you keep on telling me the answers. A high yield table. Paraffin, dusting powder, glassware, which is by hot air oven. Next, bronchoscope and cystoscope. Whenever bronchoscopy or cystoscopy is performed, it is dipped in a solution. That is 2% glutaraldehyde. It is dipped in 2% glutaraldehyde. Vaccines, serum, antibiotics. We cannot heat vaccines. We cannot heat serum. We cannot heat antibiotics. So they are sterilized by filtration. We need to filter them. They are sterilized by filtration. Milk. I need not even talk about pasteurization of milk. Asha, which method of pasteurization is better? The Holder's method, because it kills which bacteria? Which method of pasteurization is better? That is when we are heating it for a very long time, or the fast heating followed by the fast cooling? The fast heating followed by fast cooling, because it is also killing Coxella burnetii. Pasteurization. Pre-packed syringes, catgut sutures, and swabs, which is by ionizing radiation. The syringes, catgut sutures and swabs, that is by ionizing radiation. And lastly, all the culture media, surgical instruments, sputum sample before dropping. Adya agreed. Flash method is better. It's not the Holder's method. Flash method for pasteurization of milk is better. It kills Coxella burnetii. Perfect, dear. Perfect. All the culture media, surgical instruments, or sputum sample, we autoclave them. So these were the modalities for sterilization of these things. Next point. So before we start with our first topic, that is, let us start with bacteriology. In bacteriology, let us start with the first one, that is gram-positive cocci. Starting with gram-positive cocci. On the basis of catalase test, we can divide the gram-positive cocci into catalase positive, that is Staphylococcus, versus catalase negative, that is Streptococcus, on the basis of catalase test. What do we do in catalase? 3% H2O2. Hydrogen peroxide is added to the culture colonies and bubbles of nascent oxygen are seen. That is the catalase test. Have a look. This is what? Let me see if I have the image of catalase test with me. Just give me 1 sec, Piche. I do not. So no, we do. This is the catalase test. This is catalase. We are adding H2O2. We are adding H2O2 to the culture colonies and looking for bubbles of nascent oxygen. Catalase positive staph, catalase negative strep. Next, which are further divided on the basis of coagulase test into coagulase positive, that is the pathogenic staph aureus, versus coagulase negative, that is coagulase negative staph, that is non-pathogenic staph, which are divided. So before we go further, this was the catalase test. This is what catalase test looks like, versus this, which is the coagulase test, versus this, which is coagulase test. I'm not interested in telling you that coagulase test is of two types. The slide coagulase test, in which we look at the bound form of coagulase, versus tube coagulase test, in which the free form is looked. Does not matter, coagulase test. In coagulase test, if clumps are present, it is coagulase positive, that is the pathogenic staph, versus coagulase negative, that is, there is no clot or there is no clumps. Coagulase negative, which are the non-pathogenic staph. So on the basis of coagulase test, we divided it into pathogenic versus non-pathogenic staph. Non-pathogenic staph on the basis of novobiocin test, which is an antibiotic sensitivity test. What is novobiocin? Which it is an antibiotic sensitivity test. Novobiocin sensitive is staph epidermidis, which is the most common cause of infective endocarditis after early prosthetic heart valves. We will see about infective endocarditis in today's session. Novobiocin sensitive, that is staph epidermidis, versus novobiocin resistant, that is staph saprophyticus. This is antibiotic sensitivity testing. So what we have seen here is the master table of gram-positive cocci. We started with catalase test, catalase positive staph, catalase negative strep. Starting with staph, coagulase test. Coagulase positive are the pathogenic staph, coagulase negative, that is coagulase negative staph, which are divided on novobiocin antibiotic sensitivity testing. Which is the culture medium used for antibiotic sensitivity testing? Have a look. But this is antibiotic sensitivity testing. The disc diffusion method for antibiotic sensitivity testing. This is the antibiotic sensitivity testing. Which is the culture medium used? Muller-Hinton agar. We use MHA, that is Muller-Hinton agar, which is for antibiotic sensitivity testing. Next point. Around the disc, this is the antibiotic disc. If the organism is not able to grow around the disc, why? Because from the disc, the antibiotic is diffusing around it. That means a zone of inhibition is present. This is sensitive. The organism is not able to grow around the disc. Antibiotic is diffusing into the disc and the organism is not able to grow around it. Zone of inhibition is present. So the organism is sensitive to that particular antibiotic. Versus if a zone of inhibition is absent, the organism is growing all around the disc also, this organism is resistant to that particular antibiotic in the disc. Just by looking at this diagram, I do not know which antibiotic we are testing for, which is the organism, and so on. That needs to be provided to you. So this is antibiotic sensitivity testing. Next point. So this was the classification of gram-positive cocci, which this was about gram-positive cocci. Next, so this starts us with streptococci. We did the first one, that is staph. Catalase positive staph, catalase negative streptococci. Streptococci, on the basis of hemolysis, are divided into three categories. that is alpha hemolysis, which is partial hemolysis. Beta is complete hemolysis, gamma is no hemolysis. Alpha, beta, and gamma hemolysis. First, have a look. Have a look at the types of hemolysis. On blood agar, alpha hemolysis is partial hemolysis. That is why this is the streak of the colony. You are able to see a green tinge in the background. This is partial hemolysis. Versus beta hemolysis, which is complete hemolysis. Gamma is no hemolysis. Gamma is no hemolysis. So we divide streptococci on the basis of hemolysis into alpha, beta, and gamma hemolysis. Starting with the alpha hemolysis, the classical examples being strep pneumoniae and strep viridans. The ones associated with infective endocarditis, very, very important. We'll have a detailed look at this in just 2 minutes. Strep viridans associated with subacute infective endocarditis. Infective endocarditis was last time's PYQ. You need to know that. Strep pneumoniae is the most common cause of community-acquired pneumonia, strep pneumoniae. Most common cause of atypical pneumonia, mycoplasma pneumonia. Community-acquired pneumonia, strep pneumonia. The name itself has pneumonia in it. Next, coming to beta hemolysis, that is complete hemolysis. On the basis of carbohydrate C protein, we have the Lancefield classification. Lancefield has C in it, na bache. So Lancefield classification is on the basis of carbohydrate C protein. That is beta hemolytic categories A to V except I and J, which on the basis of M protein. What is the name of that classification? On the basis of M protein, that is Griffith typing. It is divided into group A, B, D. Group A are the strep pyogenes. Group B is strep agellectae versus D, that is enterococci. They are divided into groups A, B, D. A is pyogenes, B is strep agellectae versus D, that is the enterococci. This is beta hemolysis. Gamma hemolytic, no hemolytic are the strep faecalis. This is the master table of streptococci. Everybody, bache, everybody, no exceptions. Please give me a thumbs up or like the video if you are comfortable with all the points that we have seen till now. If you're comfortable with the speed of the session and everything. I know I'm going slightly faster because I want to cover more topic in this high yield session. You need not write anything, just sit and listen. We'll be taking care of 10 to 12 topics and you will be comfortable with the major chunk. Perfect, perfect. Next point. So this is with respect to streptococci. So let us have a look at infective endocarditis here only. Infective endocarditis, which it is of two types, acute versus subacute infective endocarditis. Acute infective endocarditis, this occurs in an undamaged heart. See, all of us, our heart is emotionally damaged, no doubt about it. But we are talking of structural damage here. Versus subacute infective endocarditis, that is an undamaged heart. My mistake. Versus subacute, which occurs in a partially damaged heart. Versus subacute infective endocarditis, which is in partially damaged heart. So you tell me, organism will be less severe in acute or subacute infective endocarditis? It will be less severe in subacute infective endocarditis. Why? Because it is a partially damaged heart. So even a less severe organism will be able to infect it versus acute where the organism is more severe. And the most common organism associated with acute infective endocarditis being Staph aureus versus subacute infective endocarditis where most common organism being strep viridans. An important topic, infective endocarditis. Infective endocarditis, which it affects left side of the heart. That is, it is involving mitral followed by aortic wall. It affects left side. Except in, it affects left side. Except in IV drug users. Except in IV drug users, intravenous drug users. Why? Because IV drug user, the venous return is to the right side of the heart. except in IV drug users, where right side of the heart is more commonly affected. And in IV drug users, the most common organism being Staph aureus. In IV drug users, most common organism is Staph aureus. In IV drug users, when left side of the heart is affected, in that case, the organism is Enterococcus. When left side is affected, the organism is Enterococcus. This is with respect to IV drug users. Next point. Next point. After prosthetic heart valves, this was the last time's NEET MDS PYQ. After prosthetic heart valves, we can divide prosthetic heart valves into early versus late prosthetic heart valves. Early is less than 12 months, that is abhi ek saal bhi nahi hua, just the prosthetic heart valves have been done, versus late, that is more than 12 months. After prosthetic heart valves, we can divide prosthetic heart valves into early versus late. Early prosthetic heart valves, the most common organism is cons, coagulase negative staph, that is staph epidermidis. Staph epidermidis versus late prosthetic heart valves, where the organism is, you tell me, if it is a late prosthetic heart valve, it is a partially damaged heart. That is, it is subacute infective endocarditis. So, which is the organism? Strep viridans. Easy to understand, bache. We need not rectify this. Late prosthetic heart valves, it was a partially damaged heart, no? The heart was partially damaged. So, the organism is Strep viridans. Strep viridans. And lastly, after tooth extraction, if we extract the teeth, the face is mutilated, the organism being Strep mutans. Just a way to remember, after tooth extraction, the organism being Strep mutans. This was with important features with respect to Streptococci. So we have seen the master table of gram-positive cocci. There were two main gram-positive cocci, Staphylococci, Streptococci. Catalase test, coagulase test, that those catalase and coagulase test, which they can very easily be given to you for identification also. They were important slides. Next, we had a look at the master table of Streptococci, which we divided on the basis of blood agar into alpha, beta, and gamma hemolytic. Lancefield classification is on carbohydrate C protein. Griffith typing is on the basis of M protein. Next point. This gets us to our next, that is CAMP test with respect to Streptococci only. Let's have a look at Strep agelectae. CAMP test is positive in Strep agelectae. It is an enhanced zone of hemolysis. See, we had divided beta hemolytic Streptococci into group ABC, group B beta hemolytic Streptococci. Group B is Strep agelectae, which is CAMP test positive. What is CAMP test? Again, an identification image can be given. It is an enhanced butterfly zone of hemolysis because of formation of CAMP factor that acts with Staph aureus and enhances RBC lysis. Dekho, what does this mean? Which is, this streak is that of Staph aureus. This is a streak of Staph aureus. Staph aureus is vertically streaked. A is Strep agelectae, B is Strep pyogenes. Strep pyogenes is also beta hemolytic. It is causing beta hemolysis, but there is no enhanced zone of hemolysis. This is the butterfly shaped. If there was a streak here also, we will have an enhanced zone here also. Butterfly shaped enhanced zone of hemolysis due to formation of CAMP factor, which acts synergistically. Synergistically means it will increase the hemolysis that was by Staph aureus. So Strep agelectae is CAMP test positive. This was with respect to the CAMP test. It is CAMP test positive. Next point. This gets us to gram negative cocci. We're done with gram positive. Gram negative, there are two main cocci. meningococci, gonococci. Meningococci, बच्चे, they are lens shaped. They are lens shaped. We see flat sides which are adjacent. They are lens shaped. Versus gonococci, which are kidney or bean shaped. The adjacent sides are like of kidney. Meningococci, they are both intra and extracellular, versus gonococci, which are mainly intracellular. Just a way to remember Neisseria gonorrhoeae or gonococci. It is a sexually transmitted disease. So, under hai, intracellular. I know, very stupid way to remember. It is intracellular. Versus meningococci, which are both intra and extracellular. These are the gram-negative cocci. And this gets us to an extremely important topic, that is Corynebacterium diphtheriae. So, before we start with Corynebacterium diphtheriae and stuff, let us have a look at Clostridium species. Clostridium, we are done with the gram-negative and the gram-positive cocci. This gets us to gram-positive bacilli. Gram-positive bacilli, that is Clostridium species. There are 4 main Clostridium species: Clostridium perfringens or Welchi, Clostridium tetani, botulinum, and difficile. Clostridium again is an important topic which is asked. Now, starting with the culture media used for Clostridium species, we use Robertson's cooked meat media. Culture media, Robertson's cooked meat media. If in Robertson's cooked meat media the meat pieces turn pink, then it is saccharolytic, that is Clostridium perfringens. Versus if they are black only, that is, if the meat pieces turn black, that is, it is proteolytic, which is associated with Clostridium tetani. So pink is saccharolytic. PS लिखते हैं ना. Pink is saccharolytic. Black are proteolytic. BP black are proteolytic. That is Clostridium tetani. Pink is perfringens. Next point. Clostridium species. Clostridium, of course, they are sporogenous in nature. So starting with Clostridium perfringens or Welchi. Clostridium botulinum and tetani, they are sporogenous. So starting with Clostridium perfringens, it is associated with gas gangrene. Clostridium perfringens, but it is associated with gas gangrene. That is myonecrosis. You can be given a history also. That is, there's a patient who, after developing a wound, developed crepitus or pain in that particular area with pain and crepitus. That is gas gangrene. Which are the organisms associated? PNS, perfringens, novae, and septicum. Gas gangrene. Next, what is the therapy for gas gangrene? Surgical debridement with antibiotics. If it is advanced, then amputation has to be performed. Food poisoning. The second disease associated with perfringens being food poisoning. Incubation period being 8 to 24 hours. Food poisoning. And lastly is pig bell due to uncooked pork consumption, which is seen in Americans and it is rare. That is pig bell. These are the diseases with Clostridium perfringens. Next is perfringens, but it is associated with Naegler's reaction. Recent NEET MDS PYQ. Naegler's reaction is neutralization reaction, precipitation reaction, aggregation reaction. What type of reaction is it? It is a neutralization reaction. Perfect. It is a neutralization reaction. This was the point that was asked. Naegler's reaction, Clostridium perfringens, which it is performed on egg yolk acar. What do we do in this? This is egg yolk acar. On half side there is antitoxin that is present. On the other half there is no antitoxin. Naegler's reaction, which is Clostridium perfringens, it secretes alpha toxin, which splits lecithin to form phosphatidylcholine plus lipids. These lipids, they get deposited around the colonies and cause opacity. This is the exact way it looks like. There's a colony with a white opacity around the colony. Naegler's reaction. The opacity is occurring due to deposition of lipid, Clostridium perfringens. It is a type of neutralization reaction. Next, it is associated with stormy fermentation. Stormy fermentation, that is immense fermentation with putrid smell in litmus milk. And the double zone of hemolysis. Again, an important point. There is double zone of hemolysis. The initial is a narrow zone. The inner zone is narrow. There is hemolysis, that is narrow zone of hemolysis, which is complete hemolysis due to theta toxin. And outer is the wider zone of incomplete hemolysis due to alpha toxin. So Clostridium perfringens, 3 points. 3 points. Firstly, it is associated with Nigler's reaction, which is a neutralization reaction. Stormy fermentation, litmus milk, not that important. Target hemolysis. Target hemolysis is a double zone of hemolysis. The inside is a narrow zone, which is due to theta toxin. It is complete hemolysis. Outside is incomplete hemolysis due to alpha toxin. So, target hemolysis. And lastly, reverse camp test. Bota hemolysis or accentuated zone of hemolysis or reverse camp test is Clostridium perfringens. Important though. So we saw that camp test was associated with Strep agellectae versus reverse camp test, which is associated with Clostridium perfringens. Clostridium perfringens. Next is Clostridium tetani. Clostridium tetani, which is associated with presence of terminal spores. It is a gram-positive slender organism having terminal spores, in turn giving it drumstick appearance. Tetanus, kahan se hua? The source of infection being soil, dust, or the fecal matter. Incubation period is 8 to 10 days. India is free of neonatal tetanus. Neonatal tetanus, bache, because of clean practices, antenatal immunization, clean practices, and hospital deliveries, India is free of neonatal tetanus. So this is with respect to Clostridium tetani. Next, very, very important, canned food poisoning. Clostridium botulinum. Clinical history, it is not associated with diarrhea. Canned food poisoning or botulism, bache, the minute you have a history of constipation given in your clinical history based question, there is dysphagia, diplopia with constipation, Clostridium botulinum. Clostridium botulinum. It is associated with constipation. Infant botulism is due to sporulated honey digestion, honey ingestion. See, what happens is, this is very common in North Indians and especially Punjabis also. The eldest member of the family, he or she takes honey at the tip of the finger, and when the newborn is there, on day 1 itself, it is just put in the mouth of the baby. Now, as a doctor, yes, it is frowned upon. Probably as a superstitious person and stuff, it is said that it is giving blessings to the kid. But anyways, it can be associated with, agreed, Ansika, totally agreed here. Sporulated honey ingestion in turn can be associated with infant botulism. So canned food poisoning was associated with constipation, not diarrhea. Canned hai na? So isko socho, canned, constipation, infant botulism. So it is a floppy infant syndrome. The infant is not moving. There is generalized loss of tone, weak suckling. He is constipated, lethargic. Infant botulism. And wound botulism is very rare. It is because of toxin being absorbed into blood. It is similar to food poisoning, but GI symptoms are absent. Wound botulism. This is Clostridium botulinum. The good part of botulinum, the Botox therapy. Girls will know this very well. I mean, anti-wrinkles, Botox therapy, and eye surgery for blepharospasm. Blepharospasm is the eyelids. There is increased tone, so the eyes are not opening properly. So we inject Clostridium, the neurotoxin of Clostridium botulinum. This is with respect to I totally agree. Even मुझे भी honey चटाया गया था by my grandmom only. It brings good luck, yeah. It brings good luck. As doctors, I don't know. Yes, it is frowned upon. How many of you अधहनी तुम्हें चटाया गया था. That's what we say for the Hindi speaking by your grandmom or grandfather. It is considered to bring good luck. And take my word for it. In getting selected, along with hard work, I'm sure all of you guys are working hard. There's absolutely no doubt about it. But a lot of good luck is also needed. So do good things in life, like giving chocolates to faculties and so on. But coming back, this was Clostridium botulinum. अच्छा, tell me this also, अपना चल कैसा रहा? वो अपनी, are we guys on track? We are able to study well. I'm very curious कि everything is going okay, sir. I'm working and studying. I'm doing my internship, or I'm a post intern. I come back by 4 5 p.m. I'm able to put my work. Second option ki sir, I'm a post intern. I have dropped a year. I am not working at any clinic right now, and I'm devoting all my time into studies. I'm able to give majority of the time. I'm okay. I'm okay. Third option is sir, plus minus chal raha hai. I'm getting slightly distracted. The backlog is increasing and all. Fourth option nahi, everything is in cloud only, and I'm just attending the YouTube session. Very curious. Tell me this truthfully. देखो, high yield topic sessions, everything is okay. We, as such, we have numerous grant test discussions and all. So your high yield topics are taken care of, Piche. We'll of course be doing more sessions on this, but I'm curious about our status. Those of us who are on option A and B, that is perfectly okay. Option C, but you do not, Akshita, agreed. I want more of you to tell me this. But option C, backlog is present. Do not worry. Keep on slocking, keep on working. You know more than what you think you do. Hard work is always rewarded. I strongly believe in this. Perfect. I am happy when you guys are saying either one or two. Always remember this, hard work might be rewarded slightly late in life, but it is always rewarded, and you are much closer to success than what you think. अरे बच्चे, अगर distractions नहीं होंगी life में तो कैसे चलेगा? Because I always say this, what makes us humans are our emotions. We feel low, we feel high, we fight with our parents, we fight with our partners, and so on. And of course, we love them in return also. That is what makes us human. So it's okay. It's okay. And lastly, Clostridium difficile. The classical history, why is it called difficile? Because it is difficult to culture isolate. The classical history of Clostridium difficile is irrational use of broad spectrum antibiotics. You have a history of a patient who had pneumonia, who had strep pneumonia infection, and was given antibiotics for the past 2 weeks or so on. Broad spectrum antibiotics were given, now presenting to the OPD with diarrhea. This is because the normal flora got destroyed. Clostridium difficile, it is also a normal commensal of GIT, but normally it is not attached to the mucosa of the gut. When the normal flora is destroyed, it is then attached to, especially when E. coli is destroyed, it is attached to the mucosa, leading to diarrhea and pseudomembrane formation. This is CDAD, Clostridium difficile associated diarrhea. So long-term antibiotic usage, Clostridium difficile. First class. So this was with respect to Clostridium species. Next, Acha, before we go further, I want you to tell me this. What do we see here? What do we see here? Let's have a look at 3-4 images. Before we wrap up our session, I want you to tell me. This looks like bamboo shaped appearance, which is associated with which organism? Bacillus anthracis. Anthrax, Bacillus anthracis, again an important topic. It has the classical bamboo shaped appearance. Hi, evening. Tinto screws, evening. Next, inverted furry appearance. I mean, you have come at the right time because we are talking about stabbing in gelatin culture. No double meanings with respect to stab. When we stab in gelatin culture, Nilo agreed, Hansika agreed. Stabbing in gelatin culture, giving it the inverted furry appearance. Again, Bacillus anthracis. And on blood agar, at the edge of the colonies, when we look with a hand magnifying lens, when we are looking at the edge of the colony with a hand magnifying lens, there is the presence of classical medusa head appearance. There is medusa head appearance. First class. Bacillus anthracis. Totally agreed. For demonstration of the culture, for demonstration of the capsule of Bacillus anthrax, which test is used? Remember, anthrax fedaine attack were being performed around 2004-5 with respect to Bacillus anthrax, where the spores were put in newsletters, this, that. So, McFedaine's reaction. Fedaine attack, McFedaine's reaction. Just a way to remember for demonstration of the capsule. Which stains do we use for demonstration of capsule for organisms? India ink stain, India ink or nigrosin staining. That is for the demonstration of capsule. First class. So this was about anthrax. So we are done with Clostridium species, anthrax. And this gets us to what our INI examiner suffered from this time in the exam, because he had 14 to 15 questions from mycology. Now, I am not even interested in telling you that fungi have a rigid cell wall. They have cytoplasm with a true nuclear membrane with mitochondria and endoplasmic reticulum. Next. So, okay, I just got to know that you had an oral pass session also in the morning. So yes, actually you guys are working hard, no doubt about it, Vijay. So fungi have a rigid cell wall. Cytoplasm has a nucleus with nuclear membrane, mitochondria, endoplasmic reticulum. They can be uni or multicellular. It does not matter. Point is, morphologically, there are 4 categories of fungi. That is yeast, yeast-like fungi, molds, and the dimorphic fungi. These are the 4 categories of fungi: yeast, yeast-like fungi, molds, and dimorphic. Yeast is, they are unicellular organisms which reproduce by budding. They are unicellular, they reproduce by budding. This is a yeast, that is Streptococcus neoformans. This is a yeast, Streptococcus neoformans. Yeast-like fungi, they grow partly as yeast and partly as pseudohyphae. This time's INI questions, pseudohyphae are associated with Candida albicans. I need not even tell you these points, which there were 17 questions from ecology, straightforward. Numerous bodies were also asked. We'll cover all the bodies together when we have the pathology high yield topics. We'll take care of the translocations, the bodies, stains, collagens, fixatives in our pathology high yield topic. So there were 3 questions on bodies. So yeast, Streptococcus neoformans, yeast-like fungi, Candida albicans, they show pseudohyphae. Next are the molds. Molds are branching filaments which have hyphae. So if they are growing above the culture medium, if they are projecting above the surface, it is called as, if they are projecting above the surface, it is an aerial mycelium. If they are growing in the culture medium, it is a vegetative mycelium. If it is projecting above it, it is aerial mycelium. If it is growing in the culture medium, it is a vegetative mycelium. So which are the molds? They are Aspergillus species, Rhizopus, Penicillium, and dermatophytes. These are the molds. Fungi, which you need to know. There is no shortcut to it. Aspergillus, Rhizopus. Aspergillus shows the presence of branching fungi. It shows acute angle branching. Aspergillus has acute angle branching. Aspergillus. Again, there was a question in this, I think, NEET MDS, where the answer to be marked was, we see the presence of both Aspergillus and mucormycosis. There were presence of both branching and non-branching fungi. Acute angle branching Aspergillus. So it showed mucormycosis and Aspergillus both in with the history of COVID-19. This time's PYQ. Lastly are the dimorphic fungi. Dimorphic means we see 2 types of morphology. In host tissue, they exist as yeast. In host, they exist as yeast. Whereas in culture are the mycelial forms, that is hyphae. So they are dimorphic fungi. The classical examples of which are blastomyces, coccidioidomyces, and histoplasmosis. These are the dimorphic fungi. Another recent PYQ, which is the culture medium used. Direct microscopy, we use KOH, potassium hydroxide. This was match the following question. Culture media, that was in the MBBS segment. So different culture medium were used, were given. H. pylori, Scaurus medium. LSS, Loeffler's serum slope, Corynebacterium type 3A. Fungi, KOH, potassium hydroxide, 1% KOH is used. Your MDS segment asked a question about, that was microscopy. MDS segment asked a question about Sebrode's dextrose agar. SDA, Sebrode's dextrose agar is used for culture of fungi. So all the points which are there in this are the PYQs with respect to fungi. Mycology is important. SDA with antibiotics can also be used, which will suppress the growth of bacteria. I'm not interested in telling you that chloramphenicol and cyclohexidine. Cyclohexidine suppresses contaminating fungi. Chloramphenicol suppresses bacteria. Not interested. SDA with antibiotics. Sebrode's dextrose agar, SDA with antibiotics. Tissue section. Which is the stain used for fungi? PAS, periodic acid shift, PAS and methenamine silver. Periodic acid shift and methenamine silver stains. This is fungi. Most common fungal infection associated? Candida. Most commonly, Candida albicans seen in 80 to 90% cases, mostly in immunosuppressed individuals. So how will you differentiate whether it is Candida albicans or other species, that is Tropicalis, cruciae, glabrata? How will you know that it is albicans versus others? There are two tests. We keep this as our last slide to differentiate Candida albicans from other species. We keep this as our last one, which is for culture of Candida, of course, SDA, Sebrode's dextrose agar, SDA or SDA with antibiotics. Fair enough. We differentiate Candida from other species by the germ tube test. This is what a classical germ tube looks like. This is germ tube, that is ability to form germ tubes within 2 hours when incubated in human serum. When it is incubated in human serum, it leads to the formation of germ tubes at 37 degrees Celsius. At 37 degrees. That is the germ tube test. Whereas the next is the chlamydospore formation, in which nutritionally deficient media, that is the corn meal agar, is used. That is to differentiate Candida albicans from other species. And lastly, I just got a message also, okay, sir, please make the viral inclusion bodies also. Let's make the table of the same. Let us make a table of inclusion bodies. Here only. We can divide inclusion bodies into two types. That is intracytoplasmic. They can be in the cytoplasm. Intracytoplasmic versus intranuclear inclusion bodies. Keep on telling me the names. Intracytoplasmic inclusion bodies. The one with rabies. It is always the black dog which bites. That is Nigri bodies. One with rabies, Nigri bodies. Next, molluscum contagiosum. This was again a recent PYQ. Henderson-Peterson bodies. HP bodies, Henderson-Peterson bodies, molluscum contagiosum. Next, smallpox. Though it is eradicated, but bache shows the presence of two bodies, that is guarnary bodies. It shows the presence of guarnary and passion bodies. Not much interested. It is eradicated. Just historical significance. These are intracytoplasmic. Versus intranuclear. Which can further be divided into acidophilic. That is, they are either pink, acidophilic, or they are blue. That is basophilic intranuclear bodies. Acidophilic or basophilic. Acidophilic are the Cowdery type A bodies. Acidophilic are Cowdery type A. Cowdery type A bodies, they are only acidophilic. associated with varicella zoster, associated with varicella zoster, herpes simplex, and yellow fever, Cowdery type A. They are acidophilic. Versus basophilic bodies, which are Cowdery type B bodies, which are seen in poliovirus, adenovirus. They are seen in poliovirus, adenovirus, and cytomegalovirus, Cowdery type B. Point to be noted here is poliovirus Cowdery type B is acidophilic. It is acidophilic. Let me write it like this. It is acidophilic. Adenovirus and CMV are basophilic. An extremely important table of inclusion bodies. Very, very important. We need to know this. Inclusion bodies associated with various viruses. We divided the inclusion bodies into intracytoplasmic versus intranuclear. Intracytoplasmic versus intranuclear. Rabies, black dog bites, rabies, negri bodies. Molluscum contagiosum, Henderson-Peterson, HP bodies, smallpox, Guarneri bodies, and passion bodies. Doesn't matter. Intranuclear. Acidophilic or Cowdery type A versus basophilic. B for basophilic, na Cowdery type B. Acidophilic A. A is acidophilic, B is basophilic. Only exception to this rule is polio, which is Cowdery type B, but it is an acidophilic body. It is an acidophilic body. First class. कोई बात नहीं बच्चे, sufficient. Corynebacterium type 3A, LSS, loftless serum slope, and the cuneiform arrangement. Cuneiform arrangement, that is the Chinese letter pattern. Those were the two main points which I wanted to discuss with Corynebacterium type 3A. Done. So on this note, I guess sufficient. You guys are studying since morning, no doubt about this. So let's wrap up our session at this point. Needless to say, bache, take care, and bestest of luck. We are in this together. Keep on studying, keep on slogging, do not give up. We know each other in the sense that if you have any queries or anything that you have in mind, academic, non-academic, feel completely comfortable to DM me on Telegram and give me a day, but I'll 100% be taking care of your query. Done, friends, done. So take care. Give me a thumbs up, a heart, or like the video if all of you are comfortable with the session. Any queries, write it in the comment section, and again from this video, and I'll take care of it. Thank you, and take care.